Assalamu alaikum. Myself Muhammad Anas from uvas Lahore. Imagine a muscular tube, the cervix, deciding whether the mare should be fertile or not. Today, I will walk you through a case study related to theriogenology with the title Managing Cervical Impairment in Mare, published in Clinical Theriogenology 2021. It was published by Hannah Smith and Margot McPherson. This case study beautifully highlights how careful diagnosis, bold thinking, and precise hands-on management turned a subfertile mare into a healthy brood mare. So let's begin. Starting with the case presentation, our patient was a 10 years old quarter horse mare, recently retired and athletic carrier due to severe coffin joint osteoarthritis. She had never been bred before and she was brought for the breeding management post-AI. On general and external genital examination, she had an ideal body score of 6 out of 9. Mammary glands were small and consistent with the nulliparous mare. She had clean perineum, no valvular discharge and tight valvular lips, all indicating that she had an excellent and healthy reproductive conformation. Transrectal palpation and ultrasonography revealed a moderately toned cervix and a mildly toned uterus. Both the ovaries have small multiple follicles and a CL on the left ovary. All this indicates that the animal is in this diestrous stage of its estrous cycle. She was given 250 mg of cloprostenol sodium intramuscularly to induce estrus and was examined every day. 6 days later, a dominant follicle of 35 to 40 mm diameter was observed. There was uterine edema with anechoic intraluminal fluid and the cervix was mildly dilated. Ovulation was triggered using 1.8 mg of doxylarelin acetate intramuscularly and 20 units of oxytocin was administered intramuscularly thrice a day to induce the uterine clearance. Artificial insemination was performed with 40 ml of cold transported semen. 24 hours later, a cellular fluid was observed in the uterus and a CL on the left ovary. So, uterine lavage with 5 liters of sterile saline was carried out and the oxytocin treatment continued for the next 3 days as well. It was presumed that the intraluminal fluid accumulation in the uterus was due to lack of cervical dilatation, and the issue was resolved due to uterine lavage and oxytocin treatment. The mare was discharged for recheck after 14 days. At day 14, ultrasonography was performed for pregnancy diagnosis. Ultrasonography revealed small to medium-sized multiple follicles on both the ovaries and a CL on the left ovary. Cervix was fat, toned and elongated. Uterus was filled with slightly echogenic fluid with a substantial amount up to 50 ml. The sample was taken and sent for the cytology. Cytology showed marked neutrophilic inflammation with intracellular bacteria. The culture was done to diagnose the bacteria and the results shows that the bacteria was Streptococcus subspecies Streptococcus zooepidemicus, the most frequent bacteria that it becomes the cause of bacterial endometritis. Hence, we have the diagnosis, the bacterial endometritis due to lack of cervical dilatation. The ultrasonography photos of echogenic fluid are shown here. Since we got our diagnosis, so let's move towards the treatment plan. A multimodal therapy was initiated, which includes daily uterine lavage with 5 liters of sterile saline for 5 days, immediately followed by 5 million units or international units of potassium penicillin. Along with that, based on sensitivity tests, 3.2 gram of ceftiofur crystalline free acid was given intramuscularly. Anabolics like oxytocin, 20 international units intramuscularly were also used 3 times a day, and 250 microgram of cloprostenol was administered intramuscularly to enhance the uterine clearance. Since we had the 5-day plan, so the treatment continued for 3 days, but by the end of the 3 days, the cervix remained toned and tortuous, limiting the lavage effectiveness. Fluid retention persisted for day 3, indicating a cervical dilatation problem. Considering this, on day 4, an innovative adjunct was tried. Topical butyl scopolamine bromide, commonly named Buscopan, was administered. In a way, taken 60 mg of Buscopan mixed with 1 ml of lubricant and infused intracervically using an insemination pipette. After that, digital massage was performed, which results in a visible relaxation of cervix within few minutes of topical massage. The same treatment goes for next 2 days, which dramatically improves the cervical clearance. This was innovative, off-label, yet an effective use of Buscopan, which is a smooth muscle relaxant which is normally prescribed for the colic in equines. The animal was discharged for recheck after 14 days. 14 days after therapy, ultrasonography revealed that both the ovaries are active, uterus is free of any kind of fluid, then a healthy cervix. Endometrial cytology have rare regenerative neutrophils, but there are no signs of any bacteria. cultures also showed no bacterial growth. So the infection was resolved. Since the infection is cleared, next step is breeding management. Estrus was induced by using 250 microgram of cloprostenol. Mare expressed signs of estrus after 3 days. In the meantime, daily evaluation of the mare's reproductive tract was done. Oxytocin treatment 20 international units intramuscularly was done thrice a day. Ovulation was triggered using desloratadine 1.8 mg on day 7. Mare was again inseminated using 39 ml of cold transported semen. Morning after insemination, a double ovulation was observed on the left ovary. For the next 3 days, lavage, oxytocin treatment and lubrication was done. Let's move towards the outcome of our treatment plan, which was planned for bacterial endometritis and cervical dilatation. At pregnancy diagnosis after 14 days, 2 embryonic vesicles were seen. A 16 mm vesicle in the left horn and a 14 mm vesicle in the right horn. The pictures are shown here. So we have twin pregnancy. Multiple follicles were seen on the ovaries, but 2 corpus luteums on the left ovary. Cervix was toned and elongated, and the uterus was palpably toned. No uterine edema or intraluminal fluid were seen. Using ultrasonography guidance, the vesicle in the right horn was manually crushed, leaving only a healthy embryo in the left horn. And for this sport, 500 mg of flunixin meglomine was given IV. Along with that, 20 g of altrinogest was given orally. Subsequent pregnancy checks were done at day 29 and 61 and found a viable fetus with active heartbeat at the base of the left horn. And the mare continued its pregnancy and foaled later in the spring. So, a rewarding success story. Let's summarize all the discussion we had till now. The mare's cervical impairment prevent proper drainage, leading to the post-bleeding endometritis. Quick recognition of the case, aggressive lavage, antibiotic treatment, and ecbolics therapy, and of course the novel topical use of Buscopan restored normal function and fertility. This case reminds us that the mare's cervix plays a vital defensive and functional role which is controlled by hormonal tone. Whenever dysfunction arises, the power of multimodal and an evidence-based approach and the value of creative, off-label, safe use of medicines in clinical practices can make all the difference. That's what this case study defines. Smaller actions lead to smarter outcomes and of course a rewarding success story. Thank you so much. I really appreciate your time and welcome all the questions. Thank you.